Good afternoon. Hi, I'm Mariana Hirsch, and I'm the director of the Center for the Study of Social Difference, who's hosting this wonderful event. I want to welcome our speakers. I'd like to welcome all of you. I'd like to thank Jennifer Hirsch, who put all this together and who will be introducing the panel. I just want to say something briefly about our Reframing Gender Violence series. We started this working group with the help of Sharon Marcus, who was Dean of Humanities, and the Columbia Global Centers, who encouraged us to come up with a project that would bring together the interests of faculty from across Columbia and from across the regions where our global centers are located. So this is our second year. It's a 2-year project. We've had wonderful events last year, and we'll continue in November and with 2 events in the spring semester, so please look out for those. We've been looking at the subject of gender violence from many different perspectives, disciplinary, cultural perspectives, and we've been trying to enlarge the concept of what we think of as gender-based violence. And today's event is really very, very central to our efforts because, in fact, it's been one of the impetuses for trying to engage these questions. Research that's being done about gender violence on U.S. campuses. So I'd like to introduce Jennifer Hirsch, my colleague and co-conspirator, and welcome to all of you.
Thank you, Mariana. No relation, by the way. The Hirsch is just a coincidence. So again, thank you all for joining us today. We have a really terrific panel. This is a moment, I want to credit Layla, from whom I borrowed the title Beyond Prevalence. In a conversation that she and I were having this summer, she said, we really think it's time to go beyond just measuring that this is a problem and generate research that will do something about it. So thank you, Layla, for saying that. And that is our hope, that the research that the panelists will be sharing today is the next step that will help us think about what do we need to know to generate sustainable, transformational solutions. As some of you know, I'm also the co-principal investigator of the Sexual Health Initiative to Foster Transformation, which is Columbia's commitment to providing field advancing knowledge in this forum. But actually, we're not going to be talking about SHIFT today. We're going to be talking about work from other campuses. So I'm very excited to introduce very briefly our presenters. If I gave you their full bios, it would take the whole hour and a half. So I will not do that. I will just introduce them by name and title in the order in which they will speak, and then they will speak. So first, we're going to hear from Jennifer Wagman. Jennifer is an assistant professor in the Division of Global Public Health, the Department of Medicine, and an active faculty member with UCSD's, the University of California at San Diego's Center on Gender Equity and Health. So after Dr. Wagman speaks, Liz Hutchison will speak. Liz is a historian, and she's a professor of Latin American history at the University of New Mexico, who specializes in the history of labor, gender, and sexuality in 20th century Latin America. So we are nothing if not disciplinarily diverse. Then after Liz, Layla Wood, who is a research assistant professor at UT Austin School of Social Work, and then finally speaking in tandem about the same project but from different perspectives, Meg Bossong, who is the director of sexual assault prevention and response at Williams College, will be speaking. Meg is at the end. And then either before or after her, Tammy Meredith is nationally recognized for developing computerized risk assessment protocols for both prisons and community corrections. More recently, she's been partnering with the Department of Justice SMART Office, which is the Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking Office, and the Center for Effective Public Policy on campus-focused sexual assault prevention. So I'm so appreciative of all of you for coming here, and we're super excited to hear about your work.
So, Thank you for the introduction. It's really nice to be here on your beautiful campus. Never been to Columbia, so it's really nice to be here. As mentioned, I'm from the University of California. I'm in San Diego, and I'm also I'm an assistant professor, but also a director of a UC-wide system that we have. It's a center of expertise on women's health, gender, and empowerment. And I'm going to be talking, actually, it's ironic that this panel is about going beyond prevalence, because at the University of California, we actually have never gotten to the prevalence. So I'm going to give a little bit of background about the work that's being done throughout the state of California at the University of California. So I'm assuming that a lot of us know about this, but just to provide a little bit of background, in 2014, the White House established a presidential task force on preventing sexual assault and protecting students across the United States. This was something that was a really unprecedented act from the White House, and I think a lot of us know about this, and we're going to be hearing through some of the different presentations about how this has had impact on different college campuses throughout our country. So the idea behind this task force was for colleges and universities to come together and form collaboratives so that we were really comprehensively and holistically addressing the issues of sexual assault across the communities, and really making a systematic effort to ensure that efforts were placed on prioritizing the importance of understanding violence and coming up with methods of how to prevent it and provide services to those who are experiencing it. And in the same year of 2014, the University of California created their own task force. So prior to this task force, under the leadership of our president, who was at that point and remains today, Janet Napolitano, she recognized and felt really strongly that we did have a lot of services in place and we're doing a whole lot to address and respond to sexual assault, but really felt that a lot more could be done. So she established in March 2014 a new initiative to really mirror what was going on and recommended by the White House task force. And to give a little bit of background on the University of California, for those who might not be familiar, we have the largest university system throughout the state of California. It's the largest whole system compared to any other state in the nation. We have 10 university campuses and 5 medical schools. We also have a law school that I don't think I indicated there. But we have a really large student body. Over 200,000 undergraduate students were recorded in 2016, and we have a very diverse population. So a lot of first-generation students. We have the largest number of undocumented students throughout the state of California overall, but also across the University of California. So that really creates a big issue with regard to the kinds of needs that our students might be facing or might be having. So our UC President's Task Force was launched, as mentioned, in July of 2014, and it was really established so that we would adhere to what was recommended by the White House. We wanted to employ a fair and consistent process of ensuring that all of the different campuses were having the same types of procedures across the board, so that there was a way that things could be measured, and there was a way that also we could have accountability and ensure that the students and overall population were really receiving the highest quality of care that they could be receiving. And this did include representation across all of the 10 campuses. So 7 specific recommendations were put forward, and I've included them there for you to read through. And these, again, were very similar to what was recommended by the White House task force. So over the past 3 years, a whole lot of work was done across the 10 campuses to adhere to these recommendations. There were faculty members, staff members, students, members of the community at each of the 10 campuses that were established to work together to try to achieve these goals. And as of this time right now, I'm going to quickly go through what the main accomplishments were of the task force. So one of the biggest goals, which doesn't seem like the biggest deal in the world, but it's actually really helpful, is that we didn't have previously a consistent website that really provided information about the university system as a whole, and it also provides links so that you can get details on resources and information at each of the 10 campuses. So it's a kind of a one-stop shop of internet places where anybody can go to get information, and this is for parents, faculty, of course, anyone can access this. And it's really proven to be very useful. Through statistics, we know that it's highly accessed, and people really do feel comfortable going to a website to seek information. So one of the biggest accomplishments as well was that care offices were established at each of the 10 campuses. And I shouldn't say established because some of our campuses already had care offices. These are sexual assault resource centers, and I am happy to say that we have one of our directors here in the audience today, Mandy Mount. She's from UC Irvine. And she represents one of the strongest care offices across the University of California. Some of our campuses did have these offices already in place. These are independent, confidential places where students, previously it was just for students, but it's been recently extended to offer services to faculty members, postdocs, graduate students. I think previously just for undergraduate students. Is that right? No, all students. So I've just provided a little bit of an example of what is offered at these centers, and this is from my campus, UC San Diego. It provides a comprehensive array of services to anyone in need, and people are not turned away. Anyone is welcomed regardless of what your situation is, and if care is needed elsewhere, you'll be referred. So there are educational programs, services, some specific types of approaches such as self-defense courses. It's kind of a one-stop shop as well for people who are experiencing cases of sexual assault, harassment, stalking, misconduct, or fear. Somebody wants to go in to get some support for what they think might be occurring. This is the place that they can go. So quickly to go through our accomplishments as well, we now have sexual violence response teams at each of the 10 campuses, and this is kind of building on, in addition to just having these independent sexual assault resource centers, we have collaborated efforts at each of the 10 campuses that involve a group of individuals and organizations working together, such as these counseling centers, the police force, Title IX offices. We have Title IX offices at each of the campuses. We also have now system-wide standards of investigation and adjudication. Comprehensive training education programs are available. These are required for freshmen when coming in for their new educational experience. I know this is common across a lot of campuses. This wasn't previously availed at all of the UC campuses. And we also have a system of tracking all cases that are reported throughout the university. So there's really been a lot done over the past 3 years. But we still have some gaps, and that's kind of where we're coming in from our perspective with the Center of Expertise on Women's Health, Gender, and Empowerment. We are primarily a group of researchers and programmers, faculty members who are working to address this systematically, the issues that are occurring across the University of California as well on a global perspective. So what we want to do is, again, as I was saying, that we are not yet being able to go beyond prevalence because we actually haven't established it yet. We haven't done a campus climate survey, so we don't have any statistics on what the prevalence of any cases of violence are on any of our campuses, nor do we know what the determinants or consequences are. Of course, there's a lot in the literature that really informs our knowledge, but we feel it's very important to know what's going on across the system as well as at each of our individual campuses, because that's really going to enable us to know who we're not reaching and who the key populations are in need. And will also help us know what people's awareness, what the students in particular, what their awareness is of the services that are available to them and what their rights are, what protections are in place for them. Because currently we really have no idea what students or faculty or postdoc trainings or staff, for that matter, really know about this issue. We also really want to come up with a system of monitoring and evaluation. So going through all of these great accomplishments is really exciting because it's really inspiring to be part of the largest university system in the U.S. who has this really strong, comprehensive and consistent approach to addressing these cases. But we really don't know how people are responding to them or if they're responding to them. We don't know if people know about them. We also don't know what kind of impact they're having. So of course all of the work that we're doing collectively is for the good of our community, but we really need something to be able to establish what are some of the gaps and how can we improve. So another final issue that we are focusing on with this initiative is that we have really strong comprehensive student health programs at each of our campuses, and we also have very strong counseling and psychological services. But currently there is no consistency with regard to the way in which our healthcare providers are addressing violence. So a lot, I can speak most knowledgeably about what's going on at UC San Diego. We have an amazing and very, very progressive student healthcare center that even offers hormone therapy for students who are going through sex transformations, who change. We have a lot of really kind of cutting edge work that's going on, but we don't have any systematic standards in place for screening for violence or trying to handle cases that do come in. Currently, everything's being referred, and that's really creating a huge burden on our care colleagues because they can't necessarily handle all of the cases. Additionally, we know that a lot of our students don't really feel comfortable reaching out for services related to cases of violence. However, the majority of students do come in for health services. So we really view it as an opportune way that we can start addressing some of the issues that are coming before our healthcare providers. And it's also a great opportunity to provide universal education. So in response to this, our center has established what we're referring to as our signature project on addressing these issues across the whole UC system. The lead, as mentioned, is our Center of Expertise, and we have the privilege of working very closely with the leadership of the University of California. As mentioned at the very beginning, our task force was started by our president, Janet Napolitano, and she's really championed these efforts from the very beginning. And we are very happy and fortunate to be able to work with her office. We currently have a vice president of student affairs who is very passionate about ensuring that this work not only continues but expands on what's already been done. This year in 2016, the University of California appointed our first system-wide Title IX coordinator, so we're working very closely with both of them. Also part of our initiative is close collaboration with the directors of the care centers at each of the 10 campuses, and also with the Title IX offices at each of the campuses. We're starting to work with our health centers and also with some community partners who can provide us local assistance and support that we might not necessarily have in our community. So I've just provided a little bit of background. I've already mentioned this before, that our Center of Expertise really focuses on a lot of global issues. We're also planning to, as part of this project, expand the reach of our work on campus-based sexual assault to partner with at least 3 international university partners who are also doing this work on their campuses. Currently, we're planning to work with the University of São Paulo in Brazil, the University of Swaziland in Swaziland, and one of the universities in South Africa, and we're looking for a partner in Southeast Asia. So we really want to make this effort something that can be spread across the whole, across our country as well as the world. So our specific project aims are to develop methods that we can use to assess the prevalence. As mentioned, we haven't been doing this at the University of California, so we've been doing a lot of work to partner with colleagues who we're definitely not going to be reinventing the wheel here. We know that there are many of you in the audience who have extensive expertise in this area, and we want to figure out the best way that we can launch a campus climate survey across the 10 campuses at the University of California. Our plan is to pilot test some of these surveys to make sure they're appropriate for our campuses and then scale them up so that we do a 10 campus assessment. We also want to come up with ways to evaluate the existing programs so that we can help our partners at each of the campuses improve the work that they're doing and to fill in some of the gaps that might be there. And aim, the second 3 should be 4. We want to come up with a user-friendly, very simple toolkit that will be something that we could disseminate with other universities. And I know this is also being done by others, and we're planning to partner with groups that are working on this kind of effort so that we could freely share our materials and freely share materials with people who are already working on these types of instruments. So we're doing this work in 2 phases. Currently, we're trying to procure funding to do all of these different component parts, and starting with the development of our campus climate surveys, we're hoping to start implementing those in 2018. As mentioned, we've identified some international partners and are in the process of finaling those collaborations. And we plan to, this project will be running for at least the next 3 to 4 years, but subject to change because we know from our colleagues that things change extensively as they go through these processes. So this is everything I just mentioned with regard to phase 1, doing our campus climate surveys, evaluation of what's going on, and we're starting to do the pilot test at UC San Diego on implementing interventions for our healthcare providers to start addressing violence. And then next we'll go to the international component. We really are excited to be here too, to learn from my panel colleagues and from many of you who are doing this work at your own campuses. I think it's really important for us to work together and share information because there's a lot that we can learn from each other. So in our measurement and evaluation toolkit, this is my last slide, I just wanted to put this out there too because I know some of you all are working on this type of information as well, and we had the chance to meet with our Rutgers colleagues previously about trying to figure out a system too for people who want to do this kind of work. How do you go about it? Like, how do you sift through all the multiple different instruments and tools that are out there and figure out what's the best one for you? So we're hoping that we could come up with a way that we can all work together so we can have these questions answered for our colleagues who are going to be starting this and being in our shoes in the next year or 2. So it'll be really helpful for us to be able to kind of pass along the knowledge and experience that we have. So I believe that is the end of my overview. So thank you very much.
Thank you very much. Thank you, Jennifer, for the kind introduction, and I'm happy to be fish out of water. That is a historian among a lot of real researchers. I just got excluded from IOB review, so I feel really special. And you know, historians can't give talks without a colon in the title, so I needed to come up with something catchy. But I feel like this is a wonderful study in contrast, because if there ever was a situation more different for the inauguration of intervention and research on sexual violence, campus sexual violence, that would contrast with the UC system, it would be the University of New Mexico. And that's what I'm going to talk about. That's how a historian gets involved with a bunch of sociologists and other folks looking at this work. This research is incredibly important, as I know people are here because they know that. And the situation that we offer at UNM, I think, is unique. We are the only campus right now working our way through a 3-year agreement with the Department of Justice, which is monitoring our attempts to improve the campus climate and response to victims. And ironically, that gives us one layer of protection from the Department of Education. So think about that as I talk about the possible momentum and longevity of our efforts, into which we were somewhat unwittingly placed. I have to do historical context. That's my job. And what I wanted to bring to this in this brief presentation was something of by looking at the specifics of UNM's situation, suggest the importance of looking at research in an institutional, political, local, and national context, because I think it's so important for what we can do and what impact it has that we be mindful about all that. The introduction to the University of New Mexico is on the slide, right? A public research university. We're the state flagship, which means that everybody tries to take our money. And we have 4 branch campuses, many community college and other New Mexico state institutions, but we are the University of New Mexico, which is based in Albuquerque. We are also a Hispanic serving institution, one of the few that's also a research one, Carnegie High Research University. And our student population is over 40% Hispanic, 5% Native American, many of those from tribes in the Southwest and from New Mexico proper. And it's a large commuter campus. We have some residential units, but we're characterized more by what you would call a family atmosphere. We are very much a community campus, and so the issues that we're addressing on campus through the university, I think, can't be addressed without looking at the state. We have always among the worst poverty indicators in the United States, child poverty in particular, and sexual violence against children, levels of domestic violence. We like to say in New Mexico, thank God for Mississippi, because otherwise we'd be at the bottom of all the lists in the country. It's very sad. It's very hard to climb out of the bottom rungs in a very poor state. And what brought the Department of Justice to our campus was a number, as usual, of really scandalous cases, some involving athletes and their infractions, but also a kind of steady stream of complaints that were reaching Office of Civil Rights attorneys about UNM's systematic failure to respond to the needs of survivors and other problems that I'm going to detail here. But what I want to emphasize is one reason that a lowly Latin American historian even got into the mix here was that in April of 2016, the Department of Justice announced its findings in a 37-page letter. And at that point, it became very clear that both for the Department of Justice, for UNM's administration, and for the community, the whole issue became a matter of evidence and method, of how do you perceive the realities of sexual violence, how do you measure an institutional response, and then how do you calibrate that to the expectations of students, parents, community members, faculty, staff, the whole shebang, right? And it all came to roost in this one moment of the DOJ's release of the report, and the very unfortunate press conference that followed by then President Frank, who's no longer the president of UNM. The DOJ report described its comprehensive review of university policies. They had looked at training, investigation, Title IX operation at UNM, and they had done this through what we would recognize as pretty steady empirical work, right? Site visits to campus, dozens of interviews with everyone from campus administrators and police to students, faculty, and community partners. We have a few very strong coalitions in New Mexico and a rape crisis center that's sort of grown up alongside the university and its community of feminist researchers. So we're very fortunate to have strong community partners. In the press conference, which I think illustrates my point, Bob Frank read a prepared statement that I just have to quote. The report is a snapshot. We don't believe it is the best methodology to understand what is happening on our campus. We believe that a longitudinal methodology would have been much more useful. It would follow the campus over time. We believe the report is not scientific. It's based on anecdotal data. It's not factual, and we believe it is not accurate. And the fire began. The faculty and community response, I think, mirrors this sort of tension and contest, which now a year and a half, much later, remains part of the calculus of how do you conduct research in a intensively compliant, sensitive environment. On the left, the very basic DOJ damning report. This is the short version, not the 37 pages. On the right, the marketing graphic that was presented the day after the report came out. The claim that the graphic is making, briefly, is that UNM's response prior to April of 2016 had been to commission an outside report called the Pilgrim Report on Sexual Violence, and that they had followed all of the stipulations in that report to, I think it says 96% complete. The campus was where they had responded and corrected the problem. So we started from a pretty serious impasse behind the president. We got to recognize that there were some people in our Office of Equal Opportunity, our Title IX coordinator, our compliance officers, our advocates on campus, who had been working 24/7 to make sure the DOJ report would not come out and to see that the situation got better. And so we came to this kind of crisis from very different vantage points in which faculty and staff were generally caught off guard. But these are the two sides of the conflict. So one reason I think that this ignited a lot of protest and then ultimately a lot of cooperation to address sexual violence was that President Frank insisted that the DOJ report was inaccurate and people wanted to find out if that was true. And secondly, he claimed that stopping campus sexual assault was, quote, an unattainable goal. And that it lay beyond the university's primary mission, quote, to provide high-quality education, healthcare, and research. Now, that was not the majority opinion in the administration, but it brought faculty to their feet, who then mobilized to demand an apology, particularly for the anecdotal comment. It led to a faculty senate referendum to protest particular policies that had been brought about before the DOJ, and in particular the universal mandatory reporting policy. And it also inspired this set of research that I'm going to talk about in the last few minutes by UNM researchers. Community advocates themselves protested with editorials, press releases. They made an impressive panel at the Health and Human Services Legislative Committee in August 2016. And while all of this was unfolding, the media, both local and national, broke a story about a really systematic problem in our Department of Anthropology that ultimately led to a damning OEO report that was leaked to the press and the dismissal of a faculty member. So we had both public outcry and specialized and community partners protesting the situation at UNM. So the early lessons, I would say, of this are very simple, right? I think that as we try to unpack what seemed to be the institutional crisis that UNM faced, what became very useful to us on the faculty research side was to think about it in terms of the work being done at University of Oregon by Jennifer Fried and others in the trauma created by institutional betrayal, because clearly that's where we were, right? We were in a very angry, contested situation in which both victims and members of the rape crisis community felt that the university was not responding well to this situation. We also learned that UNM is different, and yet it contains many of the same tensions that I'm sure we're going to hear about on other campuses, right? And that is, I think, for researchers, one of these things we need to keep in mind about the local context is where the research project or projects and the interests of the institution combine and where they diverge. People are always happy to hear when the campus survey is good, and they're not so happy when the numbers have gone down, right? And when your research is connected to or relying on either institutional funding or cooperation with other parts of the university, those tensions can become very difficult. I think you have to see them up front. Third, I would just say, were it not for the DOJ and the particular crisis, UNM might not have turned so much of its resources and attention to direct intervention and prevention activities, which in turn give us, sadly enough, a really important subject and focus of study, which I'm going to now just quickly talk about. I can share these slides so that I don't have to talk all the way through it, but I just wanted to see that I boiled the 37 pages down to 5 points, so you should congratulate me for that, right? And they're very broad, here described as very broad interventions. And what I'm just briefly going to show you is that in each area, UNM has had to, because of the 3-year agreement that extends to 2019, and the requirement of reporting all of its activities relative to campus sexual assault every 6 months, and the requirement that everything that UNM does with respect to sexual assault has to be sent to the DOJ and reviewed. So any policies have to go through the DOJ. So worked on the policies, made some progress, but we're still not there. I'm happy to report that a lot of faculty have become engaged in the committees responsible for review and revision of policy, which helps us bring some different perspectives to that effort. Investigation and grievance, you folks know this is a pretty hot issue and it's going to get hotter. But UNM did in fact shore up its investigation and grievance procedures. This is a nice one. If there are any administrators in the room, you can freak out right now. 27,000 students had to be trained in face-to-face sexual assault prevention by the end of December. That's a huge operation, right? We got 70 more sessions to go. Online training, 13,000 roughly staff and faculty at UNM would not be so difficult, and you can see the number of people who trained in it at the end of last year is very high. Except for all the complaining that the faculty do. I have to listen to so much complaining about these hour-long online trainings. I just say, well, let me lecture you. That'll make you happier. Finally, evaluation. The DOJ at every step requires that each intervention be evaluated. And so there's whatever we decide to do as researchers, there's a parallel universe where compliance requires that we collect evaluation forms, we do campus climate, a lot of internal things that may or may not obey the same methodologies or criteria as those we might see fit to use as researchers. So, what do we get to here? The Sexual Violence, Sexual Harassment Research Group, thank you, I can do this in 5 minutes, is a rough collection of scholars from across the campus. We're a group of about 8 people at this point, and we enjoy institutional support and moral backing from different parts of campus listed here. And you can see here the interdependence, right, of the research that we're doing with administrative units on campus. And the studies that are now underway, campus climate surveys, have been in place since 2016 and will continue. That massive training of 27,000 students is the subject of our second and growing study, which is now in its pilot phase. And our future plans have to do with looking more to athletics as well as institutional response. And that's where the historian will get to write some stuff, right? Campus climate surveys, I think, may be for this audience one of the more familiar mechanisms. I am not an expert in campus climate surveys, but I will tell you that in advance of the DOJ's report, UNM purchased one survey from National Campus Climate Survey, conducted in spring of 2016. Very high response rate. This was considered somewhat of a success, at least at UNM, for our population. And then the following spring, UNM was happy to partner with one of our faculty in pediatrics to bring the McBee study to UNM for a 3-year period. And one of the advantages to this is it's an intrinsically comparative study such that UNM's data can be looked at in terms of the effectiveness of bystander intervention across more than 24 colleges and universities. For us at UNM, it's a bit of a shift from NCCS because only 18 to 24-year-olds are surveyed, only undergraduates. The NCCS captured a much bigger population at the university. And we did have the opportunity to add questions on mandatory reporting, which the faculty wanted added. And then once it made it through the council's office, the questions looked pretty different, right? Those had to go to DOJ as well. So different issues at play here. The second major area is the study of the student trainings. First, I just show you sort of what this looks like. Multiple sessions, sometimes in conference or lecture halls of 100 or 300 students that then in the last half hour break out into groups of 15 to 20 students who are led by trainers. And it's a pretty standard bystander intervention training, but I'd like to point out that our Women's Resource Center piloted it long before we were worried about the DOJ, and now it's been adapted. So what the study does is try to get at, and this is where I think we're drawn to look at Shift's model here because we're trying to head in that direction. Look at the behaviors and attitudes of students as impacted by these trainings. So far we've looked in the past summer at the new student orientations, and now we're doing graduate student trainings, professional students, and other populations of non-first-year students that are all having to go through the gray area training. So in this design, beyond looking directly at the trainings, observing them, offering surveys to groups before and after they take the training, we're moving in the spring to do interviews, both randomly selected students, but also selected students and staff about the training exercise, and move this into a more qualitative evaluation. See, last slide, concluding questions here. My interest as a kind of coordinator for this effort is to think about what might be the broader implications of the UNM case and of DOJ oversight. And what I'd like to see come from this in the long term is a more careful and connected approach to whether the interventions are the right ones. You know, when the DOJ says train 27,000 students, you better have the right training, right? And so I realize that's not going to be replicated in the current political environment, but if it ever comes back to a point where federal oversight might actually inspire direct interventions and systematic interventions, what we want to bring to the table is we've been through it, and this works and this doesn't. So I will leave it with those questions, and thank you for your attention.
I'm Leela I'm here from the University of Texas at Austin, Steve Hicks School of Social Work, Institute on Domestic Violence and Sexual Assault. Our institute is run by our director, Dr. Noelle Bush Armendariz, who's also the principal investigator of the study I'm going to talk about today. The institute's been around for about 17 years, and it's an interdisciplinary research consortium with the School of Law, Nursing, and the Bureau of Business Research. And if you want to chat with me about how they fit in, I'd be happy to. It's a funny story. I'm going to talk today about our project, Cultivating Learning in Safe Environments, pronounced CLASE. We should have made the E small. And this is a 4-year study that is funded by our chancellor at the UT system, Chancellor McRaven, who's been really supportive of our work. When we conceived of this project, we really wanted to do a prevalence study, but we wanted to do a lot more too. We had big ideas, perhaps too big of ideas. But today I'm going to talk a little bit about what we did. We're not as big as the California system, but we're pretty darn big. 8 academic campuses, 6 medical schools, really diverse state, 3 Hispanic serving institutions, and then of course our flagship at Austin, which is where I'm at. When we talk about CLASE, we often talk about it as the shallow dive, the medium dive, and the deep dive. The shallow dive is our prevalence study that scratches the surface of what's happening on the campuses. The medium dive is mostly our qualitative work, which is what I'm going to talk about today. And true to form, I'm the qualitative researcher who has way too many slides and too much data. So I'm going to really try to rein myself in here. And then our deep dive is our 4-year longitudinal freshman cohort study, which is ongoing at UT Austin currently in its 2nd year. And of course, reporting the findings at different interim stages. This study has been undertaken in a very collaborative effort across the system. We have working groups at every campus, and we, as a research team, work collaboratively with those working groups, which are comprised of administration, faculty, students, not as much as I'd like, and other researchers who are interested in these topics on campus. So we conducted a prevalence and perception study, and I'm not going to talk about it today. But it looks very similar to our flagship numbers, look very similar to other flagship numbers. We use the ARC3 model, which I'd be happy to talk about. And these beautiful reports are available online, and you can look at them. We learned pretty much that we looked like the rest of the country, except for our structure and our diversity looks like Texas. And we realized that we needed a lot more information than we could get on that kind of survey. When we thought about conceiving this study, we knew it would have a pretty hefty qualitative component, and part of that is because we believed that there was going to be a lot of nuance to this issue. And we wanted to look at campus sexual assault, but we also wanted to look at stalking and dating violence. And we wanted to look at sexual harassment. And we wanted to understand how these issues affected undergraduate females, but we also were wondering about the rest of the campus too. So we knew that we were going to take a breadth approach, and that it would require going on site to all of these campuses and talking with a variety of folks to understand what is happening. So we really wanted to turn the crystal prism from every angle to catch the different shades of light. The best way to summarize our research questions are, what was going on here? What's happening on these campuses? So we really took the role of learners, and we started campus visits. Part of that was to build relationships, because we were going to do a survey where we asked really intense questions, but also because we wanted to understand the different kind of cultural context on each campus, the environment, and where student experiences and staff experiences were similar and how they were different. So far, because I'm going to a campus later this month, we've collected a lot of data, and boy, it's made me happy. But we have talked with faculty and staff, and that's staff from a variety of roles related to compliance in Title IX, and students, undergraduate, graduate, and medical students. Our approach is rooted in the grounded theory perspective, and with some inspiration from thematic analysis, which is kind of a prequel coding structure to grounded theory. And we have a fairly fluid interview protocol. Everybody who conducts our interviews and focus groups has experience in the field. I think that's an important thing about my perspective to this project, because I started out my career in high school as a volunteer prevention educator in middle schools and high schools. And then I worked on a college campus as a preventionist and an advocate, non-scene advocate. And I come from a big flagship school. So I think part of our approach was really rooted in this practice background of wanting to have researchers that could also go into the field and fluidly interview faculty and staff, but also students. So in our first couple years, we were looking at breadth. We're looking at this kind of large swath so that we can use the structure of theoretical sampling to get a sense of who we need to talk to next. And I always have to talk about the Lego Death Star. So our administrative person was like, do you need this picture? And I was like, yes, I cannot go to New York without this picture. And part of how I think about how we code data is we have something like a transcript or a data set, and it's the Death Star, right? And what I say is, now we have to pick apart the Death Star. Maybe we'll make a Millennium Falcon. Maybe we'll make several X-Wing fighters. Maybe we'll make the AT-AT Walker. I don't know. But that's the coding process, line by line. Then this axial phase where we start building relationships and building rooms of the Millennium Falcon. That's what I hope we're building. And then we're kind of building this new structure, this new way of looking at it. And we do that as a team with a lot of rigor. The forecast was clear what was going to happen, so this was kind of a perfect storm, which is a funny mix of metaphors. When we came into the campus environment, we started on 4 campuses, and so far we visited 6. And it was a time of heightened activity. Everybody was kind of rushing to address these issues and rushing in a thoughtful way, if that can be done. So when we started collecting data, we really wanted to understand how administrators saw what was happening on the campus, but also how students did. So now I'm going to talk about some of the major takeaways from our qualitative work. First, I'm going to talk about it from the staff and faculty perspective, because it's really important to sort these out. While there were some common themes between and among students and staff and faculty, I'm going to talk about them first in kind of separate batches. One of the things that kind of a major takeaway was this growth. And there was growth and stretching, right? Like a little bit of uncomfortable growth. People taking on new duties and roles, the duties as assigned, and not having the resources or the staff capacity to meet the compliance standards. But also people enjoying the challenge and really relishing the fact that the campus was finally addressing these issues more head-on. And with that growth came collaboration. It meant reaching across where you hadn't reached across before. One thing that became really important when we started visiting campuses is that they needed for us to listen about their culture. Texas is a very diverse state, and it's regionally diverse, it's racially and ethnically diverse, it's diverse in well, I won't talk about our governor right now, but I will say that he said something famously like, that smells sweeter once you leave Austin, but there's, the flagship is different from the rest of the state. So having 2 border community schools, there was different considerations for those students, and that meant different things to measure, and it also meant different ways of approaching data collection. We also learned a lot about how the staff and faculty felt about these issues and the kinds of ways that they wanted to convey to their students that they cared, and the ways in which that they struggled. So one thing that was important for us is to hear about how staff and faculty understood their student population and then mirror that in our data collection efforts. We talked to a lot of students, and one thing I can say unequivocally is students want more content on these issues. They don't want just one training. They want multiple trainings. They want this talked about in classrooms. They want rich discussions about these issues. And they probably want them in middle school and high school too. But they want to talk about this stuff. There's also significant barriers to reporting and services. I like that mandatory reporting came up earlier. That was something we heard a lot of confusion about, and from students in particular. And I think that one of the things that really came out was that the reporting and the barriers to reporting look a lot like they do in the community. When you look at the literature or experience working with survivors about barriers to reporting the criminal justice system, fear of not being believed, fear of being mistreated, fear of being ostracized, all very similar themes, and then just kind of applied to the campus context. One thing that came out really clearly in our data, our qualitative data, is that students, and particularly students who are marginalized and students that have other vulnerability factors, conduct their lives on campus in anticipation of potential violence. They change their routes. So at night, how many women have had to change their normal route just to feel safer? Because I know I do. So one thing we heard again and again is that people change their patterns and behaviors to feel safe, and that they work together. One student described a situation where she realized that someone she didn't know, a classmate, was being harassed by another student during class, so that she and another group of students decided they'd come early every day just to sit around this person so they didn't have to sit next to the harasser. So there's a lot of energy, a lot of protective energy that happens to try to anticipate when violence might happen and to try to protect yourself from violence. And that, I've got to think, and I'll find out a little bit more in our cohort study, that takes away from some learning opportunities. Now I want to talk about, so I could have talked a lot more about those major takeaways, and so I had to kind of edit myself a little bit. But I want to talk about, I want to kind of espouse some benefits of doing qualitative work, because I think a lot of folks have shied away from it, because some IRBs make it a little bit difficult to do qualitative work on sexual assault because of mandatory reporting issues. And also it takes a lot of time, and it takes a lot of time to analyze the data too. I want to talk about what some of the benefits of this approach of visiting each campus and doing qualitative data collection with students and faculty and staff have been for us. One is that it enhances our quantitative data. We get better quantitative data because we get deeper understanding for our qualitative data. And these are two examples. One is just kind of the simple acknowledgement that, we need to, when we're asking about disclosure, we need to ask if that disclosure happened because of mandatory reporting. That's kind of a duh, but it can happen. And then we had a couple campuses where we had really interesting kind of low safety ratings. Basically, the campus climate was, and so this qualitative work gave us a sense of why that was happening and how we needed to improve those questions in the future. Another interesting thing that happened was that we have a strong military-affiliated population in our system. Several schools have a lot of veterans and ROTC. And one interesting thing that came from our qualitative focus groups with these populations was they're getting a lot more training through the military than they are through their school. And some of their military training has a lot of implications for their bystander attitudes and behaviors. So that gave us the idea, we have all this quantitative data, let's test it. And we've run some preliminary tests, and some of the military affiliated students do have higher levels of bystander intervention skills on our self-report survey. So sometimes you learn a whole new thing. We also knew that the qualitative work was going to help us get information about marginalized populations, vulnerable populations, and populations that are just not as well understood, especially places where we weren't going to get a high enough number of participants. This happened in particular with some members of our LGBTQ group, but when we wanted to really learn more about a group, it gave us an opportunity to do that. And in particular, one of the things we're working on right now is doing more interviews with survivors. We tend not to ask a lot of questions about personal victimization experiences in focus groups. So we're really right now working on intentional recruitment, especially trying to understand more about the experience in the Title IX reporting process. Another major benefit is just understanding intersecting impacts. So how these different vulnerabilities fit together to shape the student experience, and how we can better shape and transform our measurement tools when we do more quantitative work, but also how programs and services can better work with different variety of students and be more supportive. One major benefit, so our quantitative study included an economic impact module, and we've been working on some institutional economic impact factors, but our qualitative data has actually given us the best leads from students, staff, and faculty, especially when you're thinking about things like financial aid and economic abuse in terms of like intimate partner violence, or trying to build questions about survivors' experience with dropping out of school or needing services. We really improve our quantitative measures through learning on economic impact. And we also learned about how under-resourced some of our schools are, and even schools that have a lot of resources still need more, and the kinds of support that they need. We also learned about ways that the schools are kind of scrappy and save a lot of costs, and then we can take those innovations and pass them along, or connect to different campuses who have similar issues. Another major benefit is that you just learn a lot about the campus by doing this kind of work, and it helps you build connection and community, and also get a sense of where there's areas of progress. So one school, for example, had changed their training module. We had collected data 2 different years, and they changed their training module, and we got qualitative information first that helped us build a better benchmark that module was more engaging for students. It was a switch from an online platform to a face-to-face platform. The other major benefit as a researcher is it just tells me more stuff to research. Right now, I'm thinking a lot about peer disclosures. Every single student focus group had several discussions of, my friend experienced this. Now, sometimes maybe that friend is that person, but the vast majority of students are providing some kind of support to other students. And with that support comes the experience of hearing a lot of disclosures can be stress-inducing for students, and then also being prepared to hear disclosures and sensitively respond to them. So a lot of what we've learned is that we need to take more attention to this issue of peer disclosures, not only preparing students to hear disclosures, but providing self-care and wellness skills for especially students that are engaged in activism work, hearing a lot of disclosures. And then, of course, there's benefit number 1. We better understand survivors' experiences. So I'll read this quote from a medical student. And sure enough, he stopped by my tank, and you have to wear an apron when you're cutting the body and goggles. She's explaining her first work with cadaver in medical school. A remark was made to me saying, well, you should be in the kitchen because you're a woman doing that. I bet that's where you're used to wearing an apron. So here she is, her first semester of medical school, and this professor says this to her. So one of the things that you cannot replace with a survey is learning about people's lived experiences, and especially learning about survivors. And I included, just because I come from the IPV world, this great passage from an interview we did with somebody who'd experienced partner violence, but I wanted to just end with this, because it really sums up what we learned, is when we're talking about preparing students and giving them information, we're preparing people for something that they've been taught to anticipate, or they've been taught maybe to fear, but it's an experience that doesn't have a template. And so using those skills can be a little bit more difficult if you're not expecting to have that experience. So one of the things that we learned is we have to think about a broad range of multi-dosage approaches to getting information at different time points so that students can access information as they need it, but that there's still a little bit of a falling into the unknown for some survivors. Okay, I've run out of time to talk about what I'm up to next, but I will say that more data collection with survivors and also really trying to understand more about perpetration. So as we talk about moving beyond prevalence, we still need to do benchmarking of our programs and services, and that won't change. But as a team, we're really focused on looking at issues around perpetration and doing specialized cohorts with students that have traditionally been underserved or marginalized and are as well represented on large-scale surveys. So that's where we're going next to move beyond prevalence. And thank you so much for having me.
We're very excited to be here. I'm Tammy Meredith. I am a criminologist, and for the last 23 years, I've been running a public policy research firm in Atlanta, Georgia, Applied Research Services. My colleague, Meg Bossong, she runs the sexual assault prevention and response at Williams College, and the two of us are going to talk to you about a project that we are doing in Williams College that's really about what Jennifer is calling an innovative methodology in sexual assault research. Meg's got a couple maps she's going to pass around. We're going to talk about some crazy mapping methodology. We are working on a 3-year project that's funded by the Department of Justice, Office of Justice Programs. It's called Enhancing Campus Sexual Assault Prevention Through Situational Intervention. So that's the key word we want to talk to you about today. And truly, what we're doing is developing situational interventions that supplement existing sexual assault prevention work at each campus. We're in 3 different schools. We're at MIT, Duke University, and Williams College. It's truly a participatory action project where we're developing unique strategies at each school, given what they've identified as their issue of concern. At Williams College, we're working on issues of inappropriate, unwanted touching in campus social spaces, which is occurring in campus party locations. So despite the fact that we're developing unique strategies across the 3 schools, we have some essential elements across each of the schools. One of the most important is developing some type of mapping methodology, and we're using mapping as a method of collecting and understanding student experiences on campus. All right, so the project is based on a theoretical background, a theoretical framework that really comes from 3 diverse areas. One of them, which is why I'm here, is from criminology. Our basis is from the world of crime prevention through environmental design, which is referred to as SEPTED in some places. That's the roots of situational intervention. The idea that you change the built environment to reduce opportunities to perpetrate crime. So in addition to criminology, we're drawing heavily from the world of public health, particularly interested in working on what the CDC is publishing about sexual violence on campus colleges. I'm sure that's the world that you're all working in. Of course, we're drawing from some work in social justice as well. We are strong believers in comprehensive strategies, which means, as most of you know here, our college campuses across the country, and the 3 that we're working on, are doing a really good job with individual level strategies and some peer strategies. We have very strong bystander intervention programs going on in all 3 of the colleges that we're working on, but we're trying to push them towards the world of environmental interventions and policy interventions. All right. One sentence took this team weeks and weeks to write. This is the vision of our project. We're employing environmental strategies to change physical, social, and cultural factors that facilitate both sexual and gender-based violence on campuses. You see across the top a lot of logos. We have a big team, partners working on this. This project is run out of the nonprofit Center for Effective Public Policy, which is in the DC area. We've got a lot of partners there, some of which you all probably work with, like David Lee and Cal Cascas is actually working on the Williams site with us. We are very lucky to have the rock star Holly Ryder-Malkovich on our project, formerly from University of Michigan, now at EverFi. But we've got a very large team, and we are drawing from the world of environmental management for harm prevention, strategies that are used in alcohol and other drug interventions on college campuses, particularly given the well-established connection between alcohol and sexual violence. Our goal truly in this project is to reduce sexual assault perpetration opportunities. All right, so let's talk about that innovative strategy. Here you're looking at a picture of some Williams College students that are participating in a mapping methodology. Again, we're using maps as a way to capture data on the student experience in a campus social setting, right? So we have the world of mapping was inspired really at Williams by the work that's been done in middle schools on sexual harassment and dating violence, some of the amazing work that's been done by Dr. Nan Stein at Wellesley College. And in the middle school work, that mapping methods involved using green and red crayons, where middle school students were drawing what they considered safe and unsafe places on a map of their school. When we started delving into this concept, and Meg's been working on this concept for a long time, when we started working on this with college students, we realized that there were too many dimensions to fit on a map with red and green crayons. That students were really telling us that there are all kinds of dimensions, things about their environment, issues about how they interact with other people that really dictate their feelings and their experiences in social places on a college campus. So we came up with the idea of a sticker book. So,
this is the part where I'm going to trust you. I am handing out for you to look at.
And you must return.
You must return. There are 3 going out, so 3 come back. Okay.
All right, so it's literally a sticker book, right? Where it's a booklet, it has a cover page. Here's the cover page on screen. Whoops, I'm going the wrong direction. There we go. You open it up and there's a floor plan to a party space. Students are given pages of red and green stickers. Now, the sticker book concept really comes from a place where a colleague of mine at my shop, Dr. Kevin Baldwin, he's a forensic psychologist, a sex offender expert, a licensed clinician. He and I worked for a long time on some concepts of play therapy, drawing from the world of psychology and play therapy, which really encourages children to communicate repressed emotions, address trauma, can be appropriate for adults and teens. We were thinking, all right, so maybe we come up with something that's playful for teens, giving them an avenue to discuss really emotionally charged experiences in a safe setting. So the books, now we played with lots of versions. Our original version was to create a game where you're kind of an avatar and then I can collect data on your experience. That was a little high shooting, right? So we stick to paper. We pass out, the sticker books have a cover page, and those books, when you look at them, you'll notice that it's pretty simple explanation up front. We ask the students, how do you feel in this social space at Williams College? We give them 2 books of stickers. We have them look at the front page, and we say, you've got a sheet of stickers, 10 different kinds of stickers. Each of those, in our view, are representing a dimension about their interaction in a social space. So 7 of those icons or stickers are about the environment. What happens in this party space? Talk to us about environment, lighting, noise, temperature, crowds, drunkenness, campus security. And then we have 3 stickers, icons that are about your interactions with other people in that social space. So those are about, you see the eyeballs for looking and talking, and hands for touching, especially those red hands. So the students were truly asked, very simply, to place the stickers on the map. On the inside of the map, you'll see there's a floor plan. We made 6 of these floor plans, which are the floor plans for the 6 places where campus social parties are held. And so the students could pick wherever they have some experience or thoughts or want to talk to us about a particular social space. And we told them, Look at your stickers, your icons. Use red stickers to indicate where you feel unsafe, uncomfortable, negative. Green stickers for the opposite, where you feel more safe and comfortable and positive. And we let them go. Right? So we started this only 4 months ago in May. We have over 220 student books completed so far. After we started with students, some of the staff said, hey, we want some of that sticker action. So we've collected some with staff, but we're 4 months into this, and I'm going to turn this over to Meg to talk to you about how we're using those maps to help generate ideas for interventions.
So, in many ways, Williams looks nothing like the other campuses that we have spoken about. We are a small private college, undergraduate only, about 2,100 undergraduate students, 2 very, very small master's degree programs. We're also located in rural Western Massachusetts, so that is what accounts for some of the particularities of how students socialize on our campus. For those of you who go to or have gone to school in cities, it will look nothing like your experience in New York or in Austin or San Diego or Albuquerque. So, you know, we had 2 bars in town. One of them recently closed. So now there's 1 bar in Williamstown. So most of the social life does occur in campus spaces. We conducted our first comprehensive climate survey in the 2014-15 academic year. And it was out of that campus climate survey that we began to understand unwanted touching in campus party spaces as a particular issue that we needed to address. So there's some research methodology that flows into this means of data collection. So we had a 64% completion rate on our campus climate survey and a 75% partial completion rate. We're resurveying again this fall. I don't think that I can probably replicate that, so I'm not sure how that will shake out, but what we ultimately found was that 23% of female identified students were reporting unwanted touching one time, 14% of them more than one time. 20% of gender diverse, so we had students self-report gender identity, so some people identified as trans, gender queer, gender nonconforming, so for anonymity purposes on our campus, we collapsed those into the category of gender diverse. 20% of those students reporting one-time experiences, 20% of those students reporting more than one-time experiences of unwanted touching. And then male identified students, 8% one time and 4% more than one time. So it was a different kind. When we looked at the qualitative data attached to those experiences, it was a different kind of offending behavior than the students who were experiencing completed penetrative sexual assaults. What it was telling us was that these were mostly happening in public campus event spaces. We believed that they were typically opportunistic offenders, so that there was something that was happening in those spaces, cues that were happening in the spaces. And so it made it a great candidate for this project that the Smart Office team was working on. We engaged as part of the first year of this project in a lot of focus groups, which is how we produce that list of icons. So we went through focus groups with students and said, talk to us about campus parties. What is the difference between the vibe of a great party and the vibe of a sketchy party? What's going on there? And that's how we landed on the dimensions of the mapping that's in the sticker books. So just to give you a sense of what's going on. In the spring, as Tammy said, we collected a little over 200 student maps. That represents a little over 10% of our campus population. We feel fairly comfortable that we're getting a pretty good sampling of who is doing maps. We do have some more mapping to do, but it's relatively closely mirroring our campus dynamics across a lot of different metrics. I'm happy to answer more questions about that. One of the things that we weren't sure if students were gonna put a lot of stickers on the map, but they did. They really liked this activity. One of the things is that we built it into bystander training that students were already required to go through as part of various student leadership opportunities. So those students who were going to serve in an RA capacity, who are going to be orientation leaders. We also have a process, because we require students to live on campus for all 4 years, we have an application process for a very small number of rising seniors to live off campus. And so we require bystander training for those students who are applying to live off campus their senior year in the spring of their junior year. So that's how we're capturing most of these 200 students. The interesting thing is that I had expected to see the party spaces would be described as all positive or overwhelmingly positive or all negative or overwhelmingly negative. And that wasn't the case truly in most of our maps, that there was a pretty good mix of stickers, and actually more students identified positive aspects. So there's an average of 12 green and 10 red stickers per map. Certainly there are students who are having overwhelmingly positive or negative experiences, but most students are reporting a mixture of dynamics in different spaces. And all 10 dimensions of the icons were applied. So one of the curious things, we were like, well, maybe we won't need some of these icons in the second printing of them. We'll kind of we can make them bigger. But the students are using all of the dimensions of them, and that's telling us really interesting things about the space itself, that these all become important to campus party spaces. So we've started to move into the next phase. Tammy and Holly Ryder-Milkovich were just on campus last week to do some more focus group work based on these maps. So what we did was we pulled together groups of both students and staff and showed them completed maps, showed them data, and then asked them to suggest solutions to what they were seeing. What were interventions they would use? What are solutions that they would use in the realms of the built environment, in the realm of policy and procedure that could be changed around campus event spaces, and in the realm of education and training. And so we're in the process still of gathering that data, and it's become an iterative, ongoing articulation of what we're going to do. Ways that we are using this on campus. So we are in a moment where we're about to tear down a very old, decrepit dorm and rebuild a new dorm. And so that gives us an opportunity. 3 of the 6 spaces are in student living spaces. So it gives us an opportunity to work with the design team to change the design of the social spaces in that dorm, so as not to recreate aspects of the built environment that exist in what we're seeing in the maps. Other opportunities include subtle changes that we have also made, like, yeah, sure, no problem. Oh, great. We put that on a slide. That was such a good idea. Other opportunities that are more subtle that students have not noticed. So one example that students kept identifying was noise levels, that it was too hard to hear. You couldn't hear when someone needed assistance. You couldn't hear when they were trying to talk to you. So we now have in our performer contracts for DJs and for bands decibel level limits above which those performers cannot go in the contracts that we have for them. We also have changes that we've made to the filters that we're using for lighting in the different areas, which leads to better lit dance floor spaces. And so this is not to say certainly that, we've been talking for 60 years about lighting and lighting parking garages and lighting parking lots, and this is certainly not to say that there's a causation link between poor lighting and sexual violence, but part of what is happening, is our hypothesis, is that there are cues that are going on in those social spaces. So what is happening with lighting, what's happening with the way that people are approaching alcohol consumption, is that it is cueing students' opportunistic offending behaviors in very particular ways that we think we can change with the built environment, and then ultimately pair that with other kinds of communication strategies, training for campus safety officers. So one thing that came through on the maps and in our focus groups is that focus groups early on, campus safety officers had identified to us that they were very anxious about the kinds of dancing that were going on in student spaces. And it's what I would call this sort of Footloosian concern with like the sexuality of young people. And so campus safety officers, but they were having a lot of really legitimate anxiety and saying like, I don't know what to do. It makes me really uncomfortable. I can't tell what's consensual and what's not. Interestingly, students were not identifying exactly quite what the campus safety officers were around dancing. There's a separate issue there, which I'll speak to in a second. But one of the things they were saying is that one of the surest predictors of sketchiness in party spaces is groups of watchers, clusters of predominantly or exclusively male students standing around watching the dance floor. And so one of the elements that we're pursuing is retraining campus safety officers that the intervention they need to make is breaking up those groups of watchers, not so much breaking up the dancing behavior that's going on the, in a sort of middle school, make room for Jesus kind of situation that can sometimes happen. So that's we haven't settled on final interventions yet. We're still very much in a mapping and data collection phase, but it's something that's exciting. It's something that's really ignited a lot of interest. And I think helps us build on our individual skill building aspects of our work in ways that are exciting for us. All right, where are my 3 maps?
She will get them. All right, there's 2. We're short 1. 3. Okay.
We have a little bit of time for questions after this amazing, mind-blowing panel, so I'm sure that there are questions or comments.
One, how awesome are you? That was really good. Thank you. But just out of curiosity, some of you mentioned it in different places. How did you engage? Could you speak to engaging student government and what worked, what didn't? And also, I noticed, I'm at Fordham, its own thing, so we don't necessarily have the resources, but some of the issues of faculty involvement, like who is funding this, who is authorizing this, who is blessing this, for lack of a better word, the relationships between faculty and student affairs and the administration. So any of those, but student government and that kind of interaction.
And let's get maybe the other question too, just so we can have everything on the table since we don't have, who else? Go ahead.
I was interested in the coaching the boys into men. I have no idea what that is.
Okay, another question. 1, 2, 3, and then everybody will get a chance to have a last word.
So I had a question for Elizabeth. You spoke about the DOJ and New Mexico's response. You mentioned the mandatory reporting, the hurdle. If you could explain that. And also just a general question for the panel. As a student, but also an employee of the university, agreeing to mandatory reporting was something that I was very hesitant for. If you could discuss what the pros of that process are, especially just because Columbia, that seems like a very invasive process that we have to agree to.
For such incredible projects that all of you are working on, I'm curious, my background was as a campus organizer at Yale, where we were really lucky to have an administration with a lot of funding to take on these sort of projects. And I was curious about any good practices about costing and also about working in institutions where there might not necessarily be all of the funds to undertake these sorts of exercises. And then if any of you have thoughts on this, even thinking more internationally about how to inspire this sort of work on campuses where it isn't legislatively mandated.
Okay, and then final question.
Yeah, I have a question about when we're talking about the environmental changes to help reduce the opportunities for sexual assault. Where does intimate partner violence come into that? Because there's things in public spaces on campus, but then we have to think about private relationships as well, and how those can be addressed in addition to the overwhelming support for the change of environment.
So clearly we could stay on well through the dinner hour, but I think each of you gets a couple sentences to answer the question of your choice, and then you can mix and mingle afterwards. Jennifer, you want to just...
Yeah, so I'll answer the... Oh, sorry. With regard to student involvement, I think that is likely a huge priority for all of us. At the University of California, for our initiative specifically, we have student advocates and as well as student ambassadors at each of the campuses. So they are tasked with actually working with the different student groups, and there's a whole lot going on. I would love to have Mandy answer some of those questions because she's intimately involved with the students at UC Irvine. I wanted to answer one of the other questions too about the global work. So that's a big part of what a big part of my background, as well as what we're doing with our UC initiative, since we're housed in the UC Global Health Institute. That is something that it is definitely really challenging because you're coming at, I mean, it's challenging in our own country, coming up against such a controversial issue. There's so much bureaucracy and policy issues, but what we're finding is that it's the way, I don't want to say the way around it, but what we're really doing is working with groups that are leading this work on their own campuses. So it's really being inspired by the work and motivations of students and faculty at the specific campuses. With regard to funding, that is a Pandora's box for all of us to open. We're all, I know from my part, we're struggling to find funding. Well, I'll say we're working to find funding. A lot of what's been referenced consistently is a lot of this work is being supported by the Department of Justice. Our Office of the President really put forth a lot. They put aside a lot of funding to go towards all of these efforts, so a lot of it just comes from administrative priority. There are specific foundations that are really interested in this work, and I'm happy to talk with anyone more about that, to share ideas, because we're in the thick of fundraising. I know when I came in, I spoke with Mira, I don't know if she's still here, who's the fundraiser for the Columbia-based group who's helping put on this series. So yeah, it's an ongoing process.
And I'm going to encourage the rest of you to just take the spiciest question. And then
Have you got an hour for mandatory reporting? Yeah. Mandatory reporting, which is UNM's policy, is that all staff and faculty, including graduate students, are obligated to report. It was written into our policy about a year before DOJ got to us. I think obviously with the intention from those who wrote it, to comprehensively address the problem of sexual violence on the campus. And it was a template that, come to find, doesn't sit well with a lot of folks who've received disclosures, with survivor advocacy groups, with the AAUP. I mean, there are a lot of reasons why mandatory reporting can operate to re-traumatize survivors and not necessarily encourage their engagement with the system. And anybody who's told somebody to stop talking because I have to tell knows what I'm talking about. So it was actually the issue that when faculty realized they were mandatory reporters, because there was, sporadic training, but we didn't know until there was an edict from the provost's office that we should put something on our syllabi, that we must put something on the syllabi, so the academic freedom people got all excited. And from that came a wave of faculty concern and awareness that had been formerly isolated to the women's studies and the feminist communities and the LGBT advocacy on campus, and made it into a faculty-wide issue, less so for staff, who really feel strongly that faculty must be reported on. So it's a really contentious issue. We're 2 months into a 4-month task force formed by the president at no cost. It was free to form the task force, where we're trying to design a new reporting policy that is mandatory supporting, not mandatory reporting, but does, unlike the Oregon model, which was just passed this year, does actually involve a report of de-identified information that a disclosure was made to the Title IX coordinator. We're halfway there. It's really hard. It's advocates, investigators, faculty, safety officers, compliance officers, trying to work out a new way to handle disclosures that are going to most effectively support and get students and everyone else who discloses the services they need. So I'll talk to you for an hour later.
Okay, I'm going to take the IPV question because I kind of can't quit talking about that. We'll share it. We'll share it. We need to pay more attention to intimate partner violence, and if you prevent intimate partner violence, you prevent sexual assault. So working on this has to become more of the forefront of what we're doing because these two things are so intertwined. And I heard a lot in our qualitative data collection about the lack of, you could have a staff that was really progressive and sharp on sexual assault, and they would not know what to do with an order of protection. So I think broadening our horizon on how we approach staff training to make accommodations for students, looking at some of the more progressive workplace initiatives that have happened, and also just really, it starts with recognizing the intertwined nature of those types of violence. So I was excited to hear that question because it's a really important question. And I think working on different kinds of accommodations that IPV survivors might need. And then I recently saw Dr. Becky Campbell talk about the importance of community collaboration for sexual assault, and that's true for IPV too, because survivors might want to go to their community-based resources. And it's not necessarily anything about the institution, but they may be better equipped in some communities to deal with IPV. So and it also means having campus law enforcement savvy about IPV issues. So I think it's something that we really need to pay more attention to in terms of environment, but also from a policy perspective, and working really closely with the community to better serve those survivors.
Well said, thank you. I'm going to stay on that same topic a little bit because we all know that the evidence is overwhelming that most violence that we're talking about is men's violence against women perpetrated in not public, but private spaces. So, while on the Williams project, we're not dealing with that. In fact, on none of our college campuses, we're really specifically going to focus on IPV. Not saying that it's not a huge issue and a big part of what's happening in the world of violence, but what we're working on is carving out some methodologies that can help college campuses supplement their interventions. And so to do that, we're simply working in a practical world, and as a criminologist working in the world of crime prevention through environmental design. That really pulls very strongly from the world of urban planning. So I'm very excited about the work that's going on with the UN and safe cities. And I don't know if any of you would have checked out the work going on in safe cities in Canada. Women in cities, sorry, which is another thing about urban planning and what can we do, at least structurally, to help reduce some violence. So it's not on these projects that we don't all acknowledge and know that the bulk of violence is in an intimate setting in private space, but I don't think I'm going to get past an IRB creating sticker books on people's bedrooms. And so, not that we don't think it's an issue, but I'm thinking what we're really trying to do is carve out a world where we can implement policies that campuses will actually start working on. So we think of this as a starting place, not the last place and the only place.
I'm going to try and really quickly tackle two very complicated topics. So the first is on the mandated reporting issue. The interesting thing is that Tammy's a criminologist and I am an abolitionist, and so we work really well together because she is studying criminological structures and I am for abolishing the prison industrial complex and the police system. So that's a complicated conversation that we have. But with mandated reporting, it's flowing from the Title IX structure, which is an educational civil rights structure around sexual harassment. And the contention is that there is a hostile environment which the institution is obligated to remedy, and it cannot remedy it unless they know what is going on in the institution. And so there are pockets, if someone tells a faculty member that they have been victimized by a particular person and that information goes nowhere, And then another student tells their coach that they have been victimized by the same student, and that information goes nowhere. And a third student tells a dean in a conduct process that they have been victimized by that same student. You have an individual who's creating both a very unsafe situation, they're behaving in unsafe ways, and they're creating a significant hostile environment that is costing someone their equal access to education, and the school must remedy that, right? And so that, I mean, I think if people have an understanding that reporting is not out of this kind of like reflexive need to call in the state, but about the institution's obligations to protect the educational civil rights of its students, then I think it opens up other kinds of possibilities for our conversation. It also leads me to this question about funding. So I think one argument that we have to make is that sexual violence is expensive. Intimate partner violence is expensive. And right now, those costs are mostly accruing to the individuals who experience that violence. But for your tuition-driven and also anti-capitalist, in addition to an abolitionist, so I do great in a higher ed environment. But the bottom line is that in a tuition-driven institution, we know that there are poorer academic outcomes, that the academic impacts of intimate partner violence and sexual violence persist for at least 3 semesters. And that students who experience sexual and intimate partner violence are more likely to drop out of our institutions, or to not to have what Rebecca Loya called in her dissertation research shifts in trajectory. And so for institutions who are concerned about retaining their tuition-paying student bodies, violence and victimization is causing you to lose tuition revenue every time one of those students drops out. It's ruining your 6-year graduation rates. It's ruining your data around who goes to which graduate and professional school programs. And so if you have administrators who are solely interested in those kinds of metrics, it is costing the institution money and it's costing the institution prestige because you have failed to protect the educational civil rights of the students in the institution. I think another piece that's really, that I've been lucky to experience is working at a well-funded private institution, and I need to be really honest about that. That gives me a different opportunity than folks who are in a state system. But all of your institutions have a development office, and I think thinking about the giving opportunities for people who are interested in this issue. You have alumni who are interested in giving around violence prevention initiatives, and it's an investment in the institution. It's an investment in student quality in the same way that investing in a science center or a library is an investment. And we need to have more courage from our presidents, not just about saying we take this really seriously, we have great policies, but offering this as an investment opportunity for our institutions. So I work on, I have a $250,000 one-time gift from a major donor dedicated to sexual violence prevention work on this campus because our president and our development office chose to make that a priority for our institution. And I think that that's another way of thinking about not just issuing letters, but taking real action that's invested in the longevity of our institutions.
Wow. Okay. Well, I'm sad that we have to end because clearly we could just go on all night.
We'll talk forever.
Yeah, but so thank you all so much. And